Good afternoon. Hello and welcome to today's session. Cybersecurity in Today's Health Systems, a fireside chat with industry experts. My name is Terrence Head. I am the CISO for North America here at BD, and I will be moderating this program. Before we get started, I'd like to mention a few housekeeping items. Please feel free to submit any questions through the chat box to the site of this window. We will have time reserved at the end of this program to address any questions. This presentation is being recorded for educational purposes. The replay will be available on bd.com/BD Institute within the next couple of weeks. Finally, after the webinar, we encourage you to participate in a brief 5-question survey to obtain your feedback on this event. We look forward to having your feedback. And also, just as housekeeping, this is a disclosure to say that we have no official conflicts in this presentation and the content therein. And now let's get to our panelists. First, we have John Rigi, who is the Senior Advisor, Cybersecurity and Risk, American Hospital Association. He spent nearly 30 years as a highly decorated veteran of the FBI and serves as the first Senior Advisor for Cybersecurity and Risk for the American Hospital Association and their 5,000 plus member hospitals. John leverages his distinctive experience at the FBI and CIA in the investigation and disruption of cyber threats, international organized crime, and terrorist organizations to assist on policy and advocacy issues and provide trusted advisory services for the nation's hospitals and health systems. His trusted access to hospital leadership and government agencies enhances John's national perspective and ability to provide uniquely informed risk advisory services. Welcome to the session, John.
Thank you.
And we also have Zach Rothstein, who is the Senior Vice President for Technology and Regulatory Affairs at the Advanced Medical Technology Association, otherwise known as AdvaMed, and leads the AdvaMed Center for Digital Health. In these roles, Zach advocates for transparent, predictable, and science-based medical device regulatory and legislative policies, both domestic and international, on behalf of more than 400 members. Zach's areas of regulatory and legal expertise include digital health, medical device software, cybersecurity, labeling, and post-market surveillance. Zach is also a member of the World Health Organization's Digital Health Technology Advisory Group's roster of experts. Welcome, Zach.
Thank you.
So, on behalf of BD, I'd like to thank you both for joining us and lending your insights and experience for today's discussion. To kick it off, I'm going to ask each of you to share about your roles and how you serve your constituents and what cybersecurity trends you're seeing. So, Zach, can you start us off with how you see your organization serving constituents and cybersecurity trends?
Happy to. Thanks, Terrence, and thanks to BD for putting on this webinar. I think we have a really good set of questions we're going to walk through for everybody, and looking forward to the conversation. So just to help orient everybody with AdvaMed, we are a trade organization that represents over 400 medical device manufacturers. We do only represent manufacturers of medical technologies, and part of our membership criteria is that you actually have an FDA-regulated product. So our members do represent the regulated medical device industry. The medical devices can range from implantables and also, things in the hospital that include imaging machines, bedside monitors, basically anything in a hospital that's not a doctor or a pill is frequently considered a medical device. So it's a wide range of products that we represent. Within the association, we established several years ago what we call the Center for Digital Health. And the point of this organizational structure for us is to put together in one place all of our work around the digital health ecosystem that we serve. And as part of our activities within the Digital Health Center that we operate, we have a number of work streams related to various activities that are relevant to our members. And cybersecurity has been and continues to be one of those primary areas of consideration for us. And so to walk you through how we handle some of our cybersecurity work, I put together a brief slide to just show you how we operate as an organization in this space. And our cybersecurity work started really in earnest about 6.5 years ago. And at that time, there was an increase in interest around medical device cybersecurity from the FDA, the U.S. Food and Drug Administration. Up until then, cybersecurity had been considered an element of product safety and efficacy throughout the FDA's evaluation policies, but it was never quite spelled out as a specific criteria. And back in 2013, 2014, 2015, the agency really started to develop specific policies around cybersecurity. And with those developments at the agency, AdvaMed also moved to establish a working group specific for our cybersecurity related policy issues that we need to address, both with the FDA and other government entities. So what we do as an organization is we advocate for various policy initiatives that make sense and that are implementable by our members, and that also would be meaningful for individuals who are seeking the policies to be put into place. So, for example, we deal with a lot of different comments and rulemaking proceedings before the federal government. Obviously, the FDA is always one of our primary constituents, but other federal agencies have of late been wading into the space of healthcare cybersecurity at large. And that would include groups such as the NTIA, which is the National Telecommunications Infrastructure Administration, which is part of the Department of Commerce. NIST gets involved frequently as well as the U.S. Congress, and even to an extent state congresses and legislative bodies do as well. And we engage with those individuals on an ongoing and frequently as needed basis. We also established at the association what's called an ISAO, ISAO, which stands for Information Sharing and Analysis Organization. And what an ISAO permits is for a group of individuals to share cyber threat information with each other in a secure and confidential manner. And Congress passed a law back in 2015 that gave special legal protections to encourage the use of ISAOs. And so we are very happy that we were able to set one up. We do work frequently with the FDA and other organizations to ensure that appropriate information is disseminated to the medical device community. And our members that participate in the ISAO, they sign a code of conduct and a non-disclosure agreement. So it is a pretty serious entity that we operate and run in the cybersecurity space. And then lastly, I just want to mention we do host a yearly cybersecurity summit. Similar to this event, we try to get together various individuals within the medical device and healthcare cybersecurity ecosystem. And so if this is an area of interest for you, particularly on the medical device side, please look out for the AdvaMed Cybersecurity Summit as well. So Terrence, with that, I'll turn it back to you.
Thank you so much, Zach. I'm going to hand it over to John so he could also talk about cybersecurity trends and how he advocates for his constituents as well. John?
Great. Thanks, Terrence. So first, I'll just give a general overview before I get into the trends. Here at the American Hospital Association, we are obviously very heavily involved in policy and advocacy issues. Since my joining the association about 3.5 years ago, we've also have an element of policy and advocacy focused directly on cybersecurity issues. So we're working up on the Hill and with the various government agencies. For instance, one of our big issues right now and concerns are how we will address cybersecurity in the various pending infrastructure bills out there. because cybersecurity, as we've seen, is a necessary component of all critical infrastructure. And I'll talk a little bit about the threats that we as a sector are facing and all of critical infrastructure are facing. We're also looking at positive developments such as the support for telehealth, both within legislation, funding, and policy, but also look at what are the cybersecurity concerns related to telehealth. There's various bills pending right now out there concerning reporting requirements of cybersecurity incidents. And we're actively engaged in those discussions to ensure and educate staff and members that they are aware of the implications of how the bills are worded, what constitutes notification, what constitutes an incident, so that the bills are actually meaningful and substantive for our members and really for the entire field. On the policy and advocacy side also, we are very happy to report that we contributed to the passage of a bill that was H.R. 7898 back in, back in January. And that bill provides some limited regulatory relief for HIPAA-covered entities which suffer a cyber attack. So the bill was signed into law on January 5th. We are still awaiting HHS OCR implementation. But again, great bill because it does provide some regulatory relief in the terms of expedited favorable termination of audits, mitigation of other penalties. And but the issue there is, and I think this is very positive, is that these benefits of some limited regulatory relief are extended to those organizations which can demonstrate that for the previous 12 months they've had in place recognized cybersecurity practices as defined under NIST and Section 405D of the Cybersecurity Information Sharing Act. So we're anxiously waiting to see how that's actually implemented, but we do believe that is the law of the land and that any HIPAA-covered entities which in the interim suffer a breach should be afforded some of those benefits. So since we're talking about breaches, thought it'd be a good time to do a quick pulse check on where we are, what I'm seeing on the national level based upon my interaction with members, looking at the current data, and dealing with the government almost on a daily basis. So these figures here are from the HHS's Office of Civil Rights portal, publicly accessible. So I've done some analysis and keep on going trend. Last year, we had 425 breaches impacting 26.7 million individuals. Unfortunately, we are way ahead this year, 372 breaches impacting 34.2 million individuals. For those of you that are familiar with the OCR portal, I just want to make clear, this is only hacking incidents. This is not other loss of data or compromise of data that is reported through the portal, such as a lost computer. I didn't count any of that. These are external hacks. So at 34.2 million right now, we are unfortunately running at least about 27% ahead where we were last year. And last year was a banner year as well, running ahead of 2019. And we still have 2 months to go. So unfortunately, these hacks have continued compromise of data. And I want to make clear, when we talk about impacted individuals, breaches impacting 34.2 million individuals, that doesn't mean 34.2 million individual healthcare records were stolen. That means the records of the protected health information of 34.2 million individuals were compromised or stolen. So for those of us in the field, we know that one individual electronic medical record can consist of thousands of pages of medical records. So that means there's hundreds of millions of medical records that are probably actually compromised, if not more. So when I looked at these breaches, I kind of defined 3 distinct patterns that we're seeing, the attack patterns. All right, so flipping here. They really fall into 3 categories. In the first category, well, I'm going to start at the bottom here. One from least to most significant concern is direct theft of data. Direct theft of data from the covered entity. So these are your traditional hacks, external hacks, by the way, originating from foreign-based criminal organizations and sometimes working in concert with foreign intelligence services to steal protected health information, personally identifiable information, such as dates of birth, names, social security numbers, addresses, payment information, bank account information, credit card information, and of course, intellectual property, medical research and intellectual property related to that, medical research. Of course, during the pandemic, we saw tremendous activity by foreign intelligence services working in concert with criminal gangs, criminal hacking gangs, to steal medical research related to COVID-19 treatment protocols, vaccine development, and other related research. So China, the government of China has been the most aggressive and prolific in the pursuit of U.S. Medical research. The other issue that we're seeing tremendous issues here is the third-party risk exposure. And I'm going to try to click through here. This is what happens when you have a lot of animations. Let's go through here. We get everything up. And bottom line is third-party risk comes in three forms. Basically, we have large quantities of data that we take great pains and expense to protect internally that we often give away to third parties for billing and coding for other types of services. And we've seen tremendous risk there where the adversaries, our cyber adversaries, have figured out that if they can't get to our data internally in the hospitals or health systems, they go to these third parties where we have provided them the data. So large theft of data from bulk data from third parties, business associates being used as the electronic conduit into covered entities. So if they can't compromise a hospital or health system directly, they conduct an attack on the third party and use that perhaps VPN connection, digital exchange as the pathway in. They are also software supply chain type activities where you're all familiar with SolarWinds last year, and this year we saw a compromise of the software known as Accellion. They are known as the secure file transfer system, being used extensively in healthcare to transfer data between healthcare, the covered entity, and the third-party providers. So actually seen recently an attack, software supply chain attack by sophisticated adversary, most potentially a nation state, using that compromise of the software to actually penetrate a third party that had in possession bulk data from the covered entity. And then, of course, we are very concerned about ransomware and software attacks on mission-critical third parties. So the example I use, I'm going to see if I can click through here. It's not going through. But anyway, so for instance, we had a situation this past year where a software provider that which uses a cloud platform to deliver software to run linear accelerators. So these linear accelerators deliver cancer radiation treatment. And without access to this company, it's Elekta as the company, without access to their software, their cloud software program there, these accelerators could not run. Real world impact was that cancer patients, in many instances, were delayed. Their radiation treatment was delayed for about 3 weeks. And that affected about 40 large systems across the U.S. Of course, our number one concern is the high impact ransomware attacks that we've seen across the country, targeting large hospitals, small hospitals, and everything in between. We're most concerned about these because they have the potential and have disrupted the delivery of patient care and has resulted in the delay of patient care. When you have a situation like that, we're very concerned that delay in the delivery of care, especially in emergency situations, increases the risk for a negative outcome. Bottom line, it poses a threat to patient safety. One of the things I always tell my former colleagues back at the FBI and across government is that, when you attack a hospital with a ransomware attack that results in ambulances being diverted, no availability of labs or radiology, surgeries being canceled. That's not an economic crime anymore. That's a threat to life crime. So let me stop there and go back to Terrence.
Thank you, John, for that overview. And before we get into our fireside questions, I'm going to go through an overview of cybersecurity here at BD. And I'd like to start with how we view cybersecurity through our methodology. First and foremost, there's a patient at the end of everything that we do, which places a unique set of requirements and priorities with healthcare providers and the patients we are supporting. So by design, we recognize as we incorporate a number of different practices into the design and development of processes of new technologies for our internal systems and for the commercial offerings to customers in alignment with cybersecurity industry standards. For in use, we recognize how technology, processes, and people interact and converge with each other in the real world, and how we integrate security into these workflows and the different life cycles. And through partnership, we focus on how we foster a culture of transparency and collaboration when it comes to serving and protecting BD and our customers. We are interacting with other industry stakeholders like government agencies, regulators, policymakers, and establishing industry best practices. So there's no way we can get there by ourselves. And from a transparency perspective, there's no way you can protect what you don't know. So transparency is essential to providing actionable information for our customers and our industry so we can make informed decisions on how we manage and mitigate the various cybersecurity risks, those that are known and those that are unknown. And in control, we have many different needs. Our lab and test samples and automations and diagnostic testing, to mobile care, to cloud platforms, and how we help report and support in the field for hospitals. So having a clear focus on the control and tailoring of these controls helps the business, our regions, and ultimately our customers. And building on the last slide, our principles is the foundation of everything that we do. And then also I want to say about our principles is that there's an inherent part of security and privacy, where privacy is putting the blinds on the window where no one can see in, and security is putting the bars on the window to keep people out. We also view different types of security here at BD. And first is product security, right? So this is the security of our products and the solutions that we sell to our customers, right? So each product comes with a version of software, firmware that we have to keep up with future versions, and to ensure that that product or solution is secure once it gets into the operational environment of our customers. We also have OT, or operational technology security, which is the securing of our manufacturing sites and our supply chain, of which may be on a manufacturing network, which we intend to keep separate from corporate network to reduce the footprint of vulnerability to threat actors. We have IT security, which is the security of BD managed and owned IT assets and infrastructure. And we also have physical security, which is the security of our people, our property, and information systems. And these physical threats is when someone may walk out of the door with a piece of our intellectual property, like source code, for instance. So naturally, there's a convergence of all of these different types of securities, and especially when you look at hosting, cloud-based infrastructure, products and services that's offered to our many different customers, and the connectivity and integration with our overall suite of BD solutions. And lastly, I want to step through our framework. And so our framework here is a visual representation of the various components we use to work with our businesses, regions, and functions to achieve cybersecurity excellence. Right. So we look at this as IT practices and enterprise practices that we have through service design, service transition, and service operations. So we try to map each one of these activities to different life cycles in the technology. And so when it comes to the different types of IT, manufacturing, and supply chain and product R&D, all these different life cycles and phases are different, but often the information security deliverables are very similar, if not the same. If you look over to the left there, everything kicks off with a risk assessment. So this is the initial way for the stakeholder to understand the risk associated with the technology or process being stood up. So it goes through a set of design requirements. We assess these risks through a risk scoring rubric. And then to the right, we also have some other activities there that help us to determine what the outcome is going to be. The risk assessment is a continuous iterative process that we have there. So you see a feedback loop. And so that's to say that after we go through the process, we may find new risk and have to implement certain changes. And through vulnerability scanning or static code analysis, we may have some new gaps from trying to harden the standards or the market requirements that come out of the risk assessment. And it may be a new prioritization based on the risk scores that are generated. And then I'll close with a couple things. The penetration testing that you see there in the middle is a hands-on testing security for the design of the technology that's not initially captured in the automated scanning or static code analysis. The purpose of this is to discover the weaknesses via security testing that a design of vulnerability has manifested in different ways. And then an output is the information security management plan. So this is ensure that all the boxes that are checked to the left of the framework through these various activities are the source of truth that you arrive to within the framework. An external product that we often share with our customers and stakeholders is a white paper, which is basically for commercial offerings and external consumption. It's a polished, dressed up version of our information security management plan, and it documents various activities, controls, and risks that we have been identified and implemented throughout the framework. And then once it goes to launch, it goes into the on-in phase, and it goes through various updates and potentially decommissioning and sunsetting. So, sorry about that. That will include the BD cybersecurity overview. And so now I would like to move into the fireside chat questions. We have a few questions here that we've teed up for our panelists. Thank you. And Zach, I would like to come to you first. And then John, I'll ask you to follow on and build upon Zach's response. So the question here is, how does your organization support healthcare providers as they address the types of cybersecurity concerns we've been talking about? And also, can you share a specific example? Zach?
Yeah, sure, happy to. So thanks for the question. So as you know, a policy-based organization, the best way we're able to support healthcare delivery organizations engage with medical device manufacturers on cybersecurity concerns is to act as a convening body. So we do our best to bring the sides together to have open lines of communications and ensure that both sides can talk to each other about the issues that are most pressing to them. The primary mechanism we use in this space is an organization called the Healthcare Sector Coordinating Council. That is kind of an umbrella organization that represents multiple facets of the healthcare community and brings them together and allows them to work on specific cybersecurity related issues as it impacts the entire healthcare community. One of the outputs that group put together several years ago that was a fairly major achievement for us, it was called the Joint Strategic Plan, or the JSP. That's easily available online. If you Google HSCC and JSP together, it should pop up. And in addition, we keep working on other areas as a community. And there's another document that's coming out that's been under development now on things like model contracts. So when a device manufacturer sells a product to a hospital, how those contracts should be structured to ensure these devices are updated and patched and maintained in adequate quantities going forward once they're put into the hospital environment. So, Terrence, that's the primary mechanism we use is really through open lines and engagement and ensuring that both sides are able to feel comfortable speaking to one another.
Great. John?
Yeah, thanks, Terrence. And kind of building off a little bit on what Zach said, we are, as I mentioned earlier, we're an advocacy organization as well. So we're doing what we can to represent the members' interests up on the Hill and with policymakers. But also we work across the community. We will work obviously with AdvaMed, Healthcare Sector Coordinating Council, and the Health ISAC. They're the Healthcare Information Sharing and Analysis Committee. Basically, we serve as a convening body as well for members, but also as a platform to collect, aggregate, analyze, comment on, and disseminate threat intelligence. So if you go to our website, aha.org/cybersecurity, that's quite a resource for all types of threat intelligence from government entities, and of course, whatever the latest resources that are put out there by the HSCC and HISAC. But we also get involved with very operational issues with our members. Based on my background, I'm able to help members directly when they are involved with under a cyber attack or a ransomware attack, helping them kind of understand the nature of the threat and also making those contacts with the government. We do quite a bit of that, helping our members connect with government agencies, hopefully prior to an attack, especially with the FBI, DHS, and HHS, but certainly during and post-attack as well. So we're collecting and disseminating threat intelligence. We're a platform for that. But we're also directly involved with members, helping educate them as to the nature of these threats. So we'll put on cyber workshops in collaboration with state associations and government representatives and members directly participating. And I've been doing quite a bit of tabletop exercises, cyber tabletop exercises for leadership of small hospitals and large systems. Unfortunately, as these ransomware attacks continue, and we're learning more and more after each attack what the impact is, I've been able to go out in the field and help organizations prepare for these, hopefully defend against, but ultimately also helping them respond should they become victim of a ransomware attack. And I'll stop there.
Thank you. Those were some great examples from both of you. I want to move on to the next question. What recommendations can you share for helping healthcare providers prioritize cybersecurity investments? And if you can, share what's worked well for the organizations you serve. John, I'd like to start with you.
Okay, thanks, Terrence. Very broad question. Obviously, there are multiple strategies involved when trying to determine how you allocate resources. And by the way, the resources are not just financial. We're obviously talking about human and technical resources as well. I think one of the first steps an organization has to take when they analyze how to allocate resources is understand what their risk profile is, understand what their cybersecurity risk profile is, what is their posture. Have they invested heavily over the years? If not, are they currently exposed based on the type of data perhaps that they hold? Are they conducting sensitive research that might be targeting them? So bottom line is to understand what their risk profile and risk posture is, and then help them understand that cyber risk is not just an IT issue. It is truly an enterprise risk issue. It impacts every function in the organization. Even decisions such as mergers and acquisitions can help mitigate cyber risk, but it can also expose the organization to cyber risk. The type of technology they acquire, the type of medical devices they acquire can help either mitigate cyber risk or could expose the organization to cyber risk. So I think that's the first issue, is the education and awareness that cyber risk is present wherever there's technology in the organization, wherever there's a technology-based decision, and then looking at the resources that they have currently, what their posture is, and then making some of those risk-based decisions to help them allocate the resources. Priority is always, though, trying to mitigate cyber risk as it impacts patient care and patient safety first, protection and privacy of data, important, but secondary. Thanks, Terrence.
I like how you closed that out, John. And Zach, as I ask you to also chime in on this question, so we're talking about cybersecurity investments, right? But there's also some business requirements that actually turn into IT investments. So how do we also weave in the operational environment for the HDOs and the technology that they're buying, but also being cognizant and aware of what are the cybersecurity requirements and investments for the technologies that they want to have?
Yeah, no, I think it's a great question, John. I think the answer was great, particularly from a delivery organization's perspective. Maybe just real quick, from what I've seen on the medical device side in terms of leadership involvement here is a pretty profound change. So, I mentioned we started our cybersecurity working group 6.5 years ago. At the time, cybersecurity was certainly not, as a general matter, top of mind in the C-suite of our medical device manufacturers. There were some companies that were ahead of the curve, but for the most part, that was not the case. We had a number of engineers, product security experts involved in the group. But now fast forward to today, and it's an incredible sea change that we've seen within the medical device industry, where now all of our members, I think I can safely say, their C-suite thinks about medical device cybersecurity. They care that their products remain secure, that they remain safe, obviously effective in the post-market environment. So what that means is, in today's market, when selling into a healthcare delivery organization or HDO or a hospital, these contracts, these financial agreements have to include provisions around things like who's going to service the product from a cybersecurity perspective, and how will patching and how will other updates be implemented. We're I think about at a turning point here where the FDA will be coming out soon with more directed guidance on things like patching and updates. They already have indicated that those kind of activities not only are encouraged, but they need to be made to medical devices, and that they don't trigger, in the regulatory world, there's always this concern where when you make a change to a device, you trigger a new FDA review. And FDA has said in the cybersecurity context, that's not the case. Make your cybersecurity patches, make the updates. FDA does not need to do a new review of the product, which would take time and money. So the agency has really done, I think, a good job in laying out a foundation to encourage devices to remain cyber secure to the extent they can be going forward. And again, what we're seeing now is more of a discussion around that purchasing agreement, the arm's length transactions that are being made between, say, a hospital and a device manufacturer about how the products will remain cyber secure in that post-market environment.
Great. Thanks, Zach. So our next question, I'm also going to start with you, Zach, and then go to John. Here's the question. Healthcare providers may work with hundreds of medical device manufacturers, which makes keeping up with the latest software updates and patches a common pain point. On behalf of your customers, how can medical device manufacturers collaborate more effectively with healthcare providers to ensure they have timely access to critical information for addressing cybersecurity threats?
Yeah, it's certainly a challenge, and it's something that we hear not only from our members, but from John's members and others in the healthcare industry on a regular basis. And we don't have, as an organization yet, an official position on this. But we have heard of a number of ideas, and I think we're trying to coalesce as an industry around what ideas make the most sense. Now, before I even mention any of them, I would say, as the medical device manufacturers, we wouldn't just pick an option to make this work, right? We would need to work with the hospitals, the other healthcare providers, to ensure that everybody agrees whatever mechanism we can use to reduce these pain points actually makes sense and is actually implementable for both sides. But some of the ideas I've and our members have talked about are things like Patch Tuesday, how Microsoft, once a month issues critical updates to Windows, and its other software. Maybe that's something that, as a healthcare industry, we would start doing, is kind of like a set day every month where everybody would issue those updates. And obviously anything that's super critical could come out off schedule, but otherwise, we would try to wait for that one day. We've heard talk about repositories, right? So third parties stepping in and being essentially a repository of the latest patches and other updates that can be made to these devices. A lot of medical devices do contain, similar off-the-shelf software. So in many cases, it could be that the same update could be applied across multiple brands of devices. But at the same time, a lot of devices contain a lot of homebrew code, where the manufacturer would need to also be involved with any updates. So that's something that would complicate that situation. So those are some of the ideas. I'm sure there are other ones out there too. And like I said, it's something that as an industry, we're thinking about it too. We realize it's an issue. I think we also are looking for ways to reduce the burden that this has on us. But also we want to make sure that when we do issue updates, it doesn't go into a black hole on the hospital side, but rather that the hospitals are equipped and able to actually take that incoming patch and apply it appropriately and timely as well.
Absolutely. John?
So, Terrence, I like your phrase. I think that sums this up, pain point. And for hospitals and healthcare providers, whether it's the chief medical officer, chief technology officer, or chief information security officer, applying patches to medical devices has been a consistent pain point for a number of reasons. One, just having visibility. And I do commend the industry. You've been very good about getting those out there, but in some organized fashion. I like that idea. Again, not an official position, but certainly something to look at. Having a certain day of the month or week, whenever those could get out, and for the awareness. The other issue we run into, though, quite frankly, is that when the patches come out, is who's responsible for the implementation. So often I hear from our providers, whether it's clinical engineering or the information security folks, is that, hey, this patch came out, spoke to the vendor, but we have to wait until the vendor implements the patch or they get further guidance from the manufacturer. And there may be good reasons for this, right? We want to make sure it's applied safely, because ultimately all this discussion and focus on patient safety has made hospitals more attentive to how the devices function, how those patches are implemented. But if we have to wait for the vendor or manufacturer to implement the patch, there may be a delay. I'm hearing, again, anecdotally, sometimes there is not sufficient reps in the region to implement the patches where needed for hospitals and healthcare providers. Then we have the device on the network. What do we do with it? We take the device off the network. Maybe you don't get the full utilization if it does come off the network. And of course, we internally as hospitals have to ensure that there is closer coordination within the hospital between clinical engineering and the information security folks, so that everybody has full visibility on the device status. First of all, inventory is a huge issue, often a challenge for hospitals and health systems, and that they have both functions have full visibility on the patch status. But again, I think having the manufacturers and the vendors of the devices increase their responsiveness and assistance in implementing these patches would be highly welcome.
Thank you, John. And so I'm going to get to our last question here, and maybe we'll have time for a question or two that's coming in from our live audience. This last question here is, let's talk about software component transparency and the need for a software bill of materials, otherwise known as SBOM, to give healthcare providers full visibility into the third-party software components included in medical devices. How does this initiative serve your customers and ultimately increase patient safety? And what recommendations do you have for medical device manufacturers? John?
Yeah, thanks, Terrence. I think this is one area where I can clearly say we do have an official position on behalf of the American Hospital Association. We strongly support the manufacturers providing a software bill of materials. This is one area we have actually asked that the guidance be made mandatory, and that's the position of the American Hospital Association, because we know how complex a medical device can be. There can be millions and millions of lines of code in there, and that software actually contained in the device is from many sources. It's not all from the manufacturer. There's often third and fourth party software which is built into that device, and the hospitals, the ultimate customers, may not have visibility on all those vulnerabilities, because of the complex array of software that's included in the device. And we have to rely on the manufacturer. We cannot rely on our own ability to diagnose and inventory the software inside the device. And I'll point to the issue about a year and a half ago where we had a series of vulnerabilities that were broadcast by FDA regarding medical devices called the Urgent 11 vulnerabilities. And those were a series of very critical vulnerabilities contained in many medical devices that related to third and fourth party software that was inside those devices that the healthcare provider would not have had any visibility out there on that. So, obviously we support the regulation that requires that, or the guidance that recommends this. We support making that guidance mandatory, but we also support just whatever the industry can do on a voluntary basis to work with providers to help gain that visibility into the device, because ultimately it is about patient safety. That is the medical technology that is connected directly to a patient. And quite frankly, I think with all this attention that hospitals have on cybersecurity and its impact to patient care and patient safety, if manufacturers did this on a voluntary basis, quite frankly, I think it's a great selling point. So in my view, cybersecurity, SBOM, is a great selling point. So let me stop there.
Absolutely, John. And as I go to you, Zach, you mentioned NTIA, the National Telecommunications and Information Administration. As I think back to the beginning of May or the middle of May, when the executive order on improving the nation's cybersecurity came out, there was a direction from the administration to the Department of Commerce in coordination with the NTIA to publish a minimum set of elements for SBOM. So this is not just a conversation. This is actually flowing down from the administration through the FDA. And so just help us talk about how important SBOM is and the responsibility for the MDMs and the partnership.
Yeah, absolutely. It's a great point too, Terrence, that the administration has also pushed this concept broadly. And maybe just to start there for a second, it made a lot of sense from my perspective how they went about this, where basically in the executive order, the federal government was saying, look, if you want to sell tech or IT equipment into any federal government network, doesn't matter if it's healthcare at the VA or somewhere else, you will need to at some point provide what is essentially an SBOM, right, a software bill of materials. And they started the process through NTIA, I think in part because NTIA had a couple of years ago set up a whole work stream around healthcare software bills of material. And we have hospitals and medical device manufacturers and several other parts of the supply chain working together to figure out questions like, how do we actually make an SBOM? How do we actually provision an SBOM and keep it updated and secure it and make sure that only the people that need to see it receive it? So that's, I think, partly why NTIA got the initial request to run that rulemaking or that comment period. We put in comments, John, I'm sure you all put in comments as well on the minimum elements that they were talking about. The individual who is at NTIA running that comment process now is within the organization and the federal government running a lot of the other components now of this executive order. So the federal government is certainly well equipped right now to lead a bit more on this issue and really address it from a broad industry across critical infrastructure and across federal government procurement, I think, in general. But backing up now to healthcare and to medical devices, even more specifically, SBOMs, we think as an organization, makes tremendous sense. It's something that our manufacturers should be producing. That's kind of the bottom line. But in reality, we are seeing very many of our members implementing this concept in practice through a couple of reasons. One, most of the sophisticated buyers now that we sell into are requiring some type of software bill of material. So if you want to sell into any of the major hospital systems or even some of the medium and smaller sized ones, you're going to need to provide that information just as a matter of contractual necessity. Second, FDA, while not yet requiring as an official matter that you provide a software bill of material at the pre-market stage, it's an informal requirement at this point. So it's a concept within what's called a draft guidance, meaning it's something that FDA is contemplating implementing. And actually just today, FDA confirmed through what's called the A/B list of guidance documents that this new version of this cybersecurity guidance will come out hopefully in the next couple months. They keep saying that, but really this time I think they're hopeful it'll be out in the next couple of months. But this guidance talks about a requirement to provide a software bill of materials to FDA at that pre-market submission phase. And AdvaMed's position was that makes sense. A lot of our members, like I said, are already creating them for their products. And this is a great way for FDA to ensure that a software bill of material is available for the particular product. So when the end user, gets that product, they can have the software bill of material in some format. And I think that's where we still need to work things out as a community, right? Which is, I mentioned earlier, the software bill of material can certainly be used for good, but it can also be used for bad. That's a risk-benefit issue that we have to weigh. But I think what we, as an industry, would just want to make sure is that when we develop these software bills of material, they are kept in a more or less secure manner, so that only the people that really could act on it at the hospitals and would need to know that information would have access to them. And like I said, there's a number of work streams existing outside of AdvaMed, outside of, I think, also the AHA, that are thinking about these questions. We're trying to do this in a community type way, and it's the only way we're going to get it done. But again, at the end of the day, I think it's something that we are starting to see, and it's something that will only just become more and more commonplace going forward for a number of reasons.
Great. Thank you for expanding on all the questions that we've gone through thus far. Right now, I think we have time for one question from our live audience. I want to ask the panelists, for the sake of time, to end on time, to manage your response at about a minute. This question is, the FDA says medical device manufacturers in hospitals are both responsible for protecting devices from cybersecurity threats and working together to manage the risk to patient safety. However, while there is shared responsibility, many legacy devices were not built with cybersecurity in mind, and hospitals, as the end users, ultimately carry a much heavier load for securing them from hacker attacks. Here's the question. Do you feel manufacturer support for hospitals is lacking? And what can FDA do to make it clear to manufacturers that security measures to protect legacy devices are required and not optional?
I'll let John go first if you'd like.
Well, I think we have an official position on that as well, right? So one of our positions was on lifetime support of devices. And it is, in fact, we are on record requesting that lifetime support be one of the areas where that are made mandatory. And because we are, as a field, have many of these devices in our systems, legacy devices. And sometimes a vendor will say, well, the solution to that is you just need to buy a new device. Well, that's just not possible all the time financially, especially we have many hospitals and health systems that are under this crushing burden of COVID-19 and financial pressure that's generated by that. That's not always the solution. So we had certainly, at least going forward, we'd like to see lifetime support. But our position has always been that we want to see the manufacturers provide lifetime support for these devices. Ultimately, yes, we are responsible for the device, and we're responsible for the patient. We have the live body in our facilities connected to these medical devices. And we have seen progress, I think, within the industry, which we welcome, but we're not fully there. We still, I think the majority of medical devices in organizations may be legacy devices that are out of support. Windows 7 went out. Their extended security update will end next year. Then what? We have these devices in which we cannot, in many instances, afford to replace. So I'll turn it back to Zach. By the way, I always enjoy working with Zach and AdvaMed. I just want to make that clear. We might come down on opposite sides of the issue or to have different paths, but ultimately, we're trying to improve cybersecurity and improve patient safety. So thank you.
Thanks, John. I couldn't echo that strongly enough. Totally agree. You know, it's been a pleasure working with you ever since you joined the AHA, and we've definitely enjoyed the collaboration with you as well. And you know, just on the legacy question, obviously I don't have the time right now to really do it justice, but this is an area where AdvaMed and AHA would be more likely to be, you know, a bit more at different ends of the equation here. And so, look, just as a bottom line here, maybe I want to try to end on a positive note, and that is that, you know, the legacy issue is complicated, and I don't think it's something that anybody is happy exists today. So at the end of the day, I think we're all looking for solutions. We all want to try to do our best to not only secure these devices, but of course, making sure that the patients are safe and, you know, in this context, have access to the equipment and to the services that they might need is really paramount. So, you know, the legacy question, maybe, Terrence, we have to do a whole nother webinar just on that one. We could probably spend a good hour on it, but it's certainly a fair question to ask, and one that I think is worth a lot more time and consideration.
Absolutely. Well, this is going to conclude this session here, and I'd like to thank our panelists for joining us and giving us a very engaging and honest and transparent set of perspectives and views on the answer. So thank you, John and Zach. I also like to thank all of our live audience participants for joining us today. Please be sure to complete the survey on this webinar. And I also would like to thank the people behind the scenes that help put this together. And on that note, our session is now complete. Thank you.
Thank you.
Thank you.